Scheuermann's disease, as I have said earlier, the apophyses are not well developed. There is retardation in the growth of the apophysis, and occasionally you may get anterior herniation of the discs, producing a gouged out defect in the superior anterior margin of the vertebral bodies. That also represents Schmall's node. And then we will come to the entity called metabolic bone disease, either due to hypovitaminosis or hypervitaminosis, minerals, calcium, phosphorus, aluminum, metals, iron, mercury, etc., hormones, enzymes, and muscles also play some part in the mineralization and ossification of bones. The most common, not very common, but most common in tropical countries and underdeveloped countries is rickets in children. This is due to deficiency of vitamin D and calcium. And you see cupping of the anterior ends of the ribs and also proximal ends of the humeri. Radiological characteristics, cupping of metaphyses, not only tubular bones, other bones also. Deformities of bones because of these are soft bones. That's why even if the child does normal routine walking and running, you may get deformities of bones. Frontal bossing, or the so-called craniotabes, rachitic rosary. Because there is lack of calcium, the bone is not mineralized properly, as though to compensate for that, excessive osteoid is noted. That's why rosary type of bead, technically you can find fractures easily, and eventually, if neglected, secondary hyperparathyroidism may take place. Here again, another case of scurvy. It's not rickets. Often people mistake scurvy, and differentiation between scurvy and rickets is rather difficult, but it's not that difficult because in scurvy it is osteoporosis, whereas in rickets it's osteomalacia, softening of the bones. Here they are brittle bones. Not only that, if you look at the cortex of the epiphysis, there is a thin line of cortex of the epiphysis. Look at the epiphysis for the proximal ends of the humeri. They're almost phantom type of epiphysis, but still cortical outline is noted. And ribs also, anterior widening. In this condition also we can get anterior widening. And osteoporosis is a loose term in the sense looseness of the bones, osteopenia. But when the lack of protein is there, you call it osteoporosis. Whereas if the lack of mineral is there, generally you call it osteomalacia. But occasionally, most of them coexist. Endocrinal causes of osteoporosis, Cushing, Turner's, and women, diabetes, hyperparathyroidism, hypopituitarism, hypothyroidism, namely creatine, myxedema, hypogonadism. In all these conditions, you may get generalized osteoporosis.